Chronic obstructive pulmonary disease, or COPD, is a serious and progressive lung condition that makes breathing difficult. While it can affect people of all ages, it poses a particularly significant threat to the elderly. This is because, with age, our lungs naturally lose some of their elasticity and our respiratory muscles weaken, making us more susceptible to the disease. It's estimated that over 12 million Americans are diagnosed with COPD, but millions more may have the disease and not even know it. In fact, COPD is a leading cause of death and disability in the United States. For seniors, COPD can drastically reduce their quality of life, limiting their ability to perform everyday activities and increasing their risk of other health problems. In the coming minutes, we will delve into what you need to know about COPD in the elderly. From understanding the condition itself to recognizing the symptoms, exploring treatment options, and discovering ways to improve the lives of those affected. We'll start by defining exactly what COPD encompasses. What exactly is COPD? It's an umbrella term that actually encompasses two main conditions, emphysema and chronic bronchitis. While they can occur separately, they very often coexist in people with COPD. Emphysema primarily affects the air sacs in the lungs, known as alveoli. Over time, these air sacs become damaged and lose their elasticity. Imagine tiny balloons losing their stretch. They can't effectively inflate and deflate. This damage makes it difficult to exhale, trapping air in the lungs and leading to shortness of breath. Chronic bronchitis, on the other hand, involves inflammation and irritation of the bronchial tubes which carry air to and from the lungs. This inflammation causes the lining of the tubes to thicken and produce excess mucus. The mucus narrows the airways, making it harder to breathe and causing a persistent cough. The constant coughing can further irritate the airways, creating a vicious cycle. Understanding these two components is key to understanding the complexity of COPD. Next, we'll discuss risk factors. While smoking is undoubtedly the leading cause of COPD, it's crucial to understand that several other risk factors become particularly relevant as we age. Our bodies change, and these changes can make us more vulnerable. As mentioned earlier, the natural aging process causes our lungs to lose some of their elasticity. This means they don't expand and contract as easily, making it harder to breathe deeply and clear out mucus. Additionally, the muscles involved in breathing, such as the diaphragm and intercostal muscles, tend to weaken with age. This reduces our ability to forcefully exhale and cough effectively. Beyond these age-related physiological changes, prolonged exposure to environmental irritants, such as air pollution, dust, and fumes, can also contribute to the development of COPD, especially in older adults who may have accumulated years of exposure. Furthermore, a history of childhood respiratory infections, such as pneumonia or bronchitis, can increase the risk of developing COPD later in life. It's a combination of factors that often contribute to COPD in the elderly. What are the symptoms to watch out for? One of the biggest challenges in diagnosing COPD in older adults is that its symptoms can often be mistaken for normal signs of aging. It's easy to dismiss a persistent cough or shortness of breath as simply getting old, which can delay diagnosis and treatment. The most common symptoms of COPD include a chronic cough, often producing a significant amount of mucus. This mucus, also known as phlegm or sputum, can be clear, white, yellow, or even greenish. Shortness of breath, particularly during physical activity, is another hallmark symptom. You might find yourself getting winded more easily than you used to, even with mild exertion. Wheezing, a whistling sound when you breathe, is also a common sign. It's crucial to pay attention to these symptoms and not dismiss them. If you or a loved one experiences these symptoms, especially if they are persistent or worsening, it's essential to consult a doctor. Early detection is key to managing COPD effectively and slowing its progression. Next, we'll discuss the diagnostic process. If your doctor suspects you might have COPD, they'll likely perform a series of tests to confirm the diagnosis and assess the severity of the condition. The cornerstone of COPD diagnosis is spirometry, a type of pulmonary function test. Spirometry involves breathing into a device called a spirometer, which measures how much air you can inhale and exhale and how quickly you can exhale it. The key measurement in spirometry for COPD diagnosis is the FEV1/FVC ratio. FEV1 stands for forced expiratory volume in 1 second, the amount of air you can forcefully exhale in 1 second. FVC stands for forced vital capacity, the total amount of air you can forcefully exhale after taking a deep breath. A low FEV1/FVC ratio indicates that your airways are obstructed, a hallmark of COPD. In addition to spirometry, your doctor may also order a chest X-ray to rule out other lung conditions and assess the overall health of your lungs. An arterial blood gas analysis, which measures the levels of oxygen and carbon dioxide in your blood, may also be performed to assess the severity of your COPD and how well your lungs are functioning. These tests combined give a full picture. Next, we'll discuss how COPD impacts quality of life. The impact of COPD on an elderly person's life can be profound, extending far beyond just physical limitations. The constant struggle to breathe can significantly affect their ability to perform everyday activities, leading to a decline in their overall quality of life. Simple tasks that were once taken for granted, such as walking, climbing stairs, or even dressing, can become exhausting and challenging. This can lead to a reduction in physical activity, which, in turn, can contribute to muscle weakness and fatigue, creating a downward spiral as their physical abilities decline. Elderly individuals with COPD may become increasingly isolated, withdrawing from social activities and losing contact with friends and family. The fear of breathlessness and the limitations it imposes can also lead to anxiety and depression. Many elderly individuals with COPD struggle with feelings of helplessness, frustration, and sadness. Furthermore, COPD can increase the risk of falls, as breathlessness and weakness can impair balance and coordination. It's a complex and multifaceted condition that demands a holistic approach. So what can be done? Fortunately, there are numerous treatment options available to help manage COPD symptoms and improve the quality of life for elderly individuals. Treatment plans are typically tailored to the individual's specific needs and the severity of their condition. Pharmacological interventions or medications play a crucial role in COPD management. Bronchodilators are medications that help to relax the muscles around the airways, opening them up and making it easier to breathe. These are often administered through inhalers. Inhaled corticosteroids can help reduce inflammation in the airways, further easing breathing. Combination inhalers, which contain both a bronchodilator and a corticosteroid, are also commonly prescribed. Non-pharmacological strategies are equally important. Pulmonary rehabilitation, a structured program that includes exercise training, education, and nutritional counseling, can significantly improve exercise tolerance and reduce symptoms. Oxygen therapy may be prescribed for individuals with low blood oxygen levels. And, of course, smoking cessation is paramount for those who continue to smoke. The right combination of treatments can make a significant difference. Next, we'll delve deeper into pulmonary rehabilitation. Pulmonary rehabilitation is a comprehensive program designed to help individuals with COPD improve their lung function, exercise tolerance, and overall well-being. It's not just about exercise. It's a holistic approach that addresses the physical, emotional, and educational needs of people living with COPD. A typical pulmonary rehabilitation program includes supervised exercise training, focusing on strengthening the muscles used for breathing and improving cardiovascular fitness. Education sessions provide valuable information about COPD, its management, and strategies for coping with symptoms. Nutritional counseling helps individuals optimize their diet to support lung health and maintain a healthy weight. The benefits of pulmonary rehabilitation are substantial. Participants often experience improved exercise tolerance, reduced shortness of breath, decreased fatigue, and enhanced quality of life. They also learn techniques for managing their symptoms such as breathing exercises and energy conservation strategies. Pulmonary rehabilitation empowers individuals with COPD to take control of their condition and live more active and fulfilling lives. What else can be done to help manage COPD? Beyond medical treatments and rehabilitation programs, certain lifestyle modifications can significantly impact the management of COPD and improve the overall well-being of elderly individuals. The most crucial step, without a doubt, is smoking cessation. Quitting smoking is the single most effective way to slow the progression of COPD and prevent further lung damage. Avoiding exposure to irritants, such as air pollution, dust, fumes, and strong odors, is also essential. This may involve staying indoors on days with poor air quality or using air purifiers. Maintaining a healthy weight is important, as both being overweight and underweight can negatively impact lung function. A balanced diet rich in fruits, vegetables, and lean protein can provide the necessary nutrients to support lung health. Regular vaccinations against influenza and pneumonia are also highly recommended, as these infections can trigger COPD exacerbations. These changes, while sometimes difficult, can greatly improve one's quality of life. What happens when symptoms suddenly worsen? COPD exacerbations, or flare-ups, are periods when COPD symptoms suddenly worsen. These exacerbations can be triggered by respiratory infections, air pollution, or other irritants. Recognizing them early and having a plan in place is critical to prevent serious complications. Symptoms of an exacerbation may include increased shortness of breath, more frequent or severe coughing, a change in the color or amount of mucus, and increased wheezing. It's important to know what normal looks like for you or your loved one so you can identify changes quickly. If you suspect an exacerbation, it's crucial to follow your doctor's instructions, which may include increasing the dosage of your medications or starting a course of antibiotics or corticosteroids. It's also important to know when to seek medical attention. If your symptoms are severe, if you have a fever, or if you are unable to breathe comfortably, don't hesitate to go to the emergency room. Having a written action plan, developed with your doctor, can help you respond quickly and appropriately. Next, we'll discuss palliative care. For elderly individuals with advanced COPD, palliative care can play a vital role in managing symptoms and improving quality of life. Palliative care focuses on providing relief from the symptoms and stress of a serious illness, regardless of the diagnosis or stage of the disease. Unlike hospice care, which is typically reserved for individuals with a terminal illness and a limited life expectancy, palliative care can be provided at any stage of COPD. It involves a team of healthcare professionals, including doctors, nurses, social workers, and therapists, who work together to address the physical, emotional, and spiritual needs of the patient and their family. Palliative care can help manage symptoms such as pain, shortness of breath, fatigue, and anxiety. It can also provide emotional support for patients and their families, helping them cope with the challenges of living with a chronic illness. The goal of palliative care is to improve the overall well-being of individuals with COPD and help them live as comfortably and fulfilling a life as possible. Next, we'll discuss caregiver support. Significant research efforts are underway to develop new therapies and improve the management of COPD, particularly in the elderly. Researchers are exploring novel drug targets, investigating new drug delivery methods, and developing more effective pulmonary rehabilitation programs. One promising area of research is focused on precision medicine, which involves tailoring treatment to an individual's specific genetic and clinical characteristics. This approach could lead to more effective and personalized therapies for COPD. Researchers are also investigating new strategies for preventing COPD exacerbations, which are a major cause of morbidity and mortality in elderly individuals with the disease. Furthermore, there is growing interest in developing interventions to address the non-pulmonary manifestations of COPD, such as muscle weakness, malnutrition, and depression. These efforts hold the promise of improving the overall quality of life for elderly individuals living with COPD. What's the key takeaway from all this information? In conclusion, COPD poses a significant threat to the health and well-being of elderly individuals, but it is not an insurmountable one. Early detection, comprehensive management, and supportive care can make a profound difference in improving the lives of those living with this condition. By recognizing the risk factors, understanding the symptoms, and seeking prompt medical attention, we can ensure that COPD is diagnosed early and managed effectively. By embracing lifestyle modifications, participating in pulmonary rehabilitation, and exploring treatment options, elderly individuals with COPD can maintain their independence and enjoy a higher quality of life. And by providing compassionate care and support, we can help those living with COPD navigate the challenges of this disease and live as comfortably and fulfilling a life as possible. While COPD presents challenges, with knowledge, action, and support, a better quality of life is within reach. Remember, you are not alone. This key point is a duplicate of the previous one, key point 13, so I will provide a slightly different angle for the conclusion, still summarizing and reinforcing the key message. COPD in the elderly presents a complex challenge, but as we've explored, there's a wealth of knowledge and strategies available to mitigate its impact. From understanding the disease's mechanisms and risk factors to recognizing symptoms early and implementing personalized treatment plans, we've covered a broad spectrum of information. The importance of lifestyle modifications, particularly smoking cessation and avoiding irritants, cannot be overstated. Pulmonary rehabilitation and palliative care offer valuable support in managing symptoms and improving quality of life, and, crucially, caregivers play a vital role in providing essential care and support to elderly individuals with COPD. Ultimately, the goal is to empower elderly individuals with COPD to live as actively and comfortably as possible. By combining medical advancements with lifestyle adjustments and compassionate care, we can help them navigate the challenges of this disease and maintain their independence and well-being. Remember to consult with your healthcare provider for personalized advice and treatment. This is the final key point, the conclusion. It should summarize and leave the listener with a sense of hope and empowerment. We've journeyed through a comprehensive understanding of COPD in the elderly, highlighting its challenges and, more importantly, the strategies for managing and mitigating its impact. The key takeaway is this: early detection, comprehensive management, and unwavering supportive care are paramount in improving the lives of elderly individuals living with COPD. Remember, recognizing the risk factors and symptoms early on allows for timely diagnosis and intervention. Personalized treatment plans, combining pharmacological and non-pharmacological approaches, can effectively manage symptoms and improve lung function. Lifestyle modifications such as smoking cessation and avoiding irritants play a crucial role in slowing disease progression. And perhaps most importantly, remember the power of supportive care. Caregivers, family members, and healthcare professionals all contribute to creating a network of support that empowers individuals with COPD to live fulfilling lives. While COPD presents significant challenges, it is not a hopeless situation. With knowledge, proactive management, and compassionate support, elderly individuals with COPD can live longer, healthier, and more meaningful lives. There is always hope, and you are not alone on this journey.